Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So as you will see, I've done what is an En Bloc 10/16/24, initials LW. So she had implants from 2019, what are saline implants. I cut out the scar. She had a lift before, and as you can see, some areas of the capsule are so thin, and some areas where I've had to remove these quote nodular, like lobular type masses. Again, you will see some of them are so thin, completely done in what is En Bloc. You can see some areas thick, some areas very saran wrap thin. So I'm going to go ahead and open the right side up, 10/16/24, initials LW. So as I go in here, you will see these are saline implants that she's had. Her second set, the first one were silicone in 2017. So these are the second set. Now, as I go in, you can see how she had a grade 3 contracture, which means that the breast tissue was hardened. She's only 35 years of age, out of town. And let me go in from here. You can see this tissue around is bad. You can see just by looking at it. So this has had to go as well. So here we go. Now I just want you to notice and see how thin this capsule is. And I'm going to go ahead and slide this underneath. And no matter how thin, the capsule has to go, and you will see why. And I'm going to go in. My blunt scissors are always pointing up, and as you will see as I go in, no matter how thin, I hear some patients say where, you know, I've had to remove residual capsules. Their surgeon said, oh, the capsule was so thin it was benign. No, it has to go, and that's the whole surgery. Anyone can remove implants, and as you will see, it's all about the capsule and the inflamed tissue around the capsule. We have seen fibroadenoma, which is the most common benign tumor, fat necrosis, histiocytic giant reaction. What is a overfilled implant? She said it's 550, filled to 550. You can see as I remove completely, you will see this is your Allergan 465, filled to 550. So you can see the pressure on the sides, grade 3 contracture, saline implants, and look at this. It's very hard, even though this is transparent and thin. If I put it right here, you can read the ruler 4, 5, 6. If I pull this out, you can hear, look at this. I cannot even tear it. It's so thin. You think I should leave it back? No. And you can hear, if I try to tear it, this has this crunchiness to it. You can actually hear it. And so this is why this needs to be removed no matter how thin. You cannot just gauge by looking at it and saying, and if I cut it, you will hear the sound. So I'm going to try to tear it. You can see it is thick. It's rigid. I cannot tear it even though it looks so thin. Same thing over here. So complete total capsuloma. I'm going to go ahead and remove my top glove so I can cut out the left side. So left side, I cut out the tissue so as to contour the left side with respect to the right. I cut out the scar. You can see some areas very thin, some areas thick. I'm actually going to go ahead and show you complete removal. You can see again very, very thin, some areas thick. I didn't like how this tissue looked, so I removed it. Actually, let me go in from here so you can see. You can see, look, there is tissue on the inside. It does not look healthy. You do not want to leave this behind. So the take-home message from this video is, no matter how thin the capsule, it has to all go. And the inflamed tissue around has to go as well. You can see, look, this is not healthy tissue right here that I'm removing. So this tissue is not healthy. I'm going to actually go in from here, I'm going to hold with my hand. I don't want to damage the implant. The whole surgery is where, now you can see right here, look at this. I'm going to go in. So here we go. You can see there's that stickiness. That's the small amount of leaching from the silicone shell of that saline implant. You can see the pressure around, and this is your 465 filled to 550. So you can see how overfilled this is. And having grade 3 contracture. And as you will see right here, same thing. Look how saran wrap thin this is. This is not normal human tissue. So this is why no matter how thin it is, it has to be removed completely, definitively. Look at this again. If you ask me, there is silica inside. Now the ultimate way is cut this out and send it to a lab like at University of Michigan mass spectroscopy, and they will tell you exactly what this is. And this is the problem. If you leave this behind, this is where the patients will continue to be hurt and react to this tissue. And so the capsule must go, and the inflamed tissue around the capsule must also go. So the implants will be returned to the patient. Capsules will be sent to pathology, rule out BIA, ALCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology. Cultures are done for aerobic, anaerobic, and fungal. And most importantly, this young lady, 35 years of age, from out of state, we will see how she does from her many symptoms of breast implant illness. So I just want to also mention the take-home messages. If I hear a lot of surgeons say, well, it looked fine, so I left the capsule behind, it looked thin. I will tell you, this is not normal tissue. I have a patient, two things I just want to mention. I have a pathology report from a patient where the CD30 analysis came back positive. And you can see automatically she is, this happened just last night when I looked at the pathology. So the patient, now they sent the slides over to another outside institution, which is not uncommon, so that they can get a second opinion, because this is a big deal. I'm going to let the patient know she has to follow up with a breast center and a cancer center in order to get a full comprehensive detailed workup by a medical oncologist, given the CD30 positive, because remember, this is relatively rare but underreported. We hear from a lot of surgeons who say that I didn't remove the capsule because it looked normal. You cannot tell by looking at it that it looks normal. You can see, look how thin it is. It certainly does not look normal. It has to be removed. And even when the surgeons do remove parts of it or incompletely, they're not sending it off to pathology. Even when it goes to pathology, they're not doing a CD30 analysis. And because that's not done, we know clearly from the society, from the plastic surgeons, from the doctors, that the BIALCL rate is underreported for that reason. Now remember, we just want to be thorough, meticulous, and detailed, because if you're not ruling that out, we're leaving suspicion and potentially problems behind, because you cannot tell, one cannot tell by looking at the capsule if it is pathologic or not. Only when the pathologist looks at it and stains it appropriately will we know what it is and what it is not. So there you have it. This is Dr. Khan, Executive Plastic Surgery.